All right, we are back again, a clinical conversation with Steven Kiak, Digital Health Manager at CORA, Ashley Langford, Director of Clinical Excellence at CORA, and this is going to be a short segment. We are going to try to stump Steven with telehealth exercises. How do you perform these telehealth exercises? And I'm going to kick it off with a simple one. There must be some kind of like a row. If I had to do a row at home that was resisted, what am I using to do my row at home resisted?
Yeah, so a lot of times, patients do have bands from being already in the clinic. So if that's available, we would absolutely, refer to what they've already have. But if they don't have a bands, a lot of times is what we can do is create resistance against a towel and have the door actually swing against a weight. So that's going to be pulling the weight the entire time, which is going to create that same kind of resistance across the range of motion.
Okay. Ashley, what do you got?
All right. I'm going to try to stump you, Steve.
Sure.
So how about long arc quads, which for those that don't know, that's basically full knee extension. So you'd be seated and straightening your knee to strengthen your quads.
Yeah, so we've done that a few ways. We've actually used the patient's belt and attached it like a water bottle or, a gallon of milk or half gallon of milk, depending on their strength, to their ankle. And that creates that resistance that you'd get in the clinic by adding an ankle weight.
Okay, I have one. What
Mhm.
about that thing, that Ranger, or like the it's like a rope thing?
So that one is extremely hard to mimic. The way we kind of do that is, again, is that's an active assisted range of motion, is by using a cane or a broomstick to kind of facilitate that motion up.
Okay.
All right. So I'm thinking in the typical therapy gym, I always liked using like your total gyms because you could do squats at like a percentage of body weight. Let's say you got someone that you don't want them doing full sit to stands or squats. How do you mimic that at home?
Absolutely. In a range of motion perspective, what we can actually do is tell them, do you have a cushion? There's thin cushions that they have, those decorative cushions that we all know our significant others love. And also, do you have a thicker cushion, the actual couch cushion that you want, maybe a quarter squat? That way they can do that. And if they need a little bit more assistance, we can actually say, hey, do you have a chair with armrest? That way you can use a little bit of your upper extremity, or a counter that you can use a little bit of your upper extremity to help pull you up that extra little bit.
What about like self-massage? So like if I need to do like a soft tissue, and are there any like things around the house that I can use for that if I don't have like a Theragun or ice thing?
Absolutely. Adam, do you play golf? Do you play tennis? Do you play
Um,
pickleball? Those balls are, really good weights, and they can kind of just dig in there and roll in and pinpoint those muscles, for plantar fasciitis. A frozen water bottle mimics a lot of what you need, and that's cooling and it's that rigidness.
it's good.
All right. You sold him at golf, by the way. All right. So how about this? What about a warm up? Typically in a clinic, you got a treadmill, recumbent bike. What do you do to warm someone up for the start of a session?
A lot of the patients that come to us on telehealth do this either on a tablet or on a mobile device that they can be carried with them throughout their house. So we can physically, for a warm up, have them walk a lap or two in their own house.
Good. Man, he's good.
He's good, man. I don't know. All right, anything, Stephen? I don't have any more, but what's the craziest apparatus you've used?
Uh, I actually had a professional driver go see with us, and he had a resisted cervical device that we used and hooked to a stone wall. That
For
was
like
probably
neck
one of the
strengthening.
Yeah, that was probably one of the craziest ones that he had access to that I've used over telehealth.
Wow.
How
Yeah.
Cool.
long does it take for people? Do you do this, or do you kind of like, all right, we're going to do this in the future? You explained it to them, and then they gather their tools and you guys arts and crafts together in the next session, or do you just kind of figure it out in enough time in a single session?
I typically can think on my feet pretty well, and that's one of the perks of telehealth is being able to do that. But if you know that you're going to progress something in the near future, be like, hey, would you mind going to the dollar store and getting a ball? Think of a total knee extension where you have something where you're trying to extend your knee in a stance position to mimic function of walking. Well, I can have them put it against the wall, and I can have them push their knee into the pressure of the ball with the air, and that's going to mimic a band. Stuff like that. So if you know that's going to come up and that's their next step, can absolutely mention it.
Great point. There's a lot of stuff you can get nowadays for cheap.
All right. Yeah, did you think of any others, Ashley? Otherwise, we're going to wrap
He's
this up. This is a quick.
yeah, he stumped me.
Good
Thought
job,
we'd have-
Steven. You've
Thanks,
stumped
Scott.
the brain of CORA. The Pocket PT wins this. Thank you for listening. Thanks for joining, guys. We'll talk soon.
Yeah.